The broadcast is now starting. All attendees are in listen-only mode.
Welcome to eGestalt's webinar titled HIPAA HITECH Compliance, How to Effectively Manage the Security and Compliance Status for Your Business Associates and Subcontractors. Today's presenter is Anupam Sahai, co-founder and president eGestalt. Anupam is an accomplished management, marketing, and technology leader with 21 plus years of experience directing teams to develop and launch globally renowned products generating up to $350 million annually. Prior to eGestalt, Anupam was Vice President Marketing for Ixia Inc. He is a recognized expert in the areas of cloud computing, security, networking, and is a featured speaker at several industry conferences worldwide. If you have any questions, please send them via the questions function in GoToWebinar, and we will address them at the end of the presentation. If you'd like a copy of the presentation, please send an email directly to Anupam. His contact information will be given at the end. Thank you, Anupam, for presenting, and I'll turn the webinar over to you now.
Thank you, Mike. Good morning and good afternoon, everybody. With respect to the items that I'll be presenting today, I'll start off by talking about HIPAA HITECH requirements for medical providers and their business associates and subcontractors. Then I'll jump into some best practices and caveats that are a result of the real-world experiences that some of our partners and customers have been following to implement a formal vendor management program, which allows them to manage their business associates as well. And then I'll talk about automated tools for doing vendor management, doing business associate management, by talking about a tool called SecureGRC, followed up by concluding remarks. Before I jump into the presentation, let me just make some standard disclaimers around HIPAA and HITECH. While we have made sure that the information is current and it's gleans the latest information and releases from HHS, by no means this is supposed to be definitive or used for auditing or legal purposes. This is just meant for your information, and the information is subject to change and shared without warranty. So let me start off by talking about HIPAA and HITECH. What are the scope of HIPAA and HITECH, and then jump into some of the requirements for medical providers and business associates. So HIPAA was enacted in 1996, but really it's in 2009 when the American Recovery and Reinvestment Act was enacted, wherein HITECH came about, that really HIPAA has started to get some more enforcement teeth, and all the aspects that I'm going to cover today are going to cover, in terms of scope, cover both HIPAA and HITECH. Some acronyms that I'll keep referring to. I just want to explain that right up front so that as we go through the presentation, this becomes self-evident. HHS stands for Department of Health and Human Services. It's a principal agency in the U.S. government for protecting the health of all Americans. OCR is the Office of Civil Rights. It's the enforcement agency, again, in the government, responsible for enforcement of HIPAA and HITECH. PHI and EPHI. PHI stands for Protected Health Information. It's the key information that HIPAA and HITECH is trying to protect, and the guidelines from HIPAA and HITECH are focused around protecting PHI, and EPHI is electronic version of the protected health information. CE stands for covered entity, BA stands for business associate, etc. So with respect to scope of HIPAA HITECH, while there's a lot of talk about HIPAA HITECH leading to better IT practices, but it's not just about technology. It's really focused around improving healthcare. And the way healthcare is going to improve is by putting together better practices, better processes, and better technology-related processes that allow sharing, coordination, and administration of healthcare, and also safeguarding information so that patients and medical providers and everybody who are involved in medical care providing and administration feel comfortable in sharing information and trusting each other. So it's all about making sharing and administration of healthcare easily done through these processes. That's where HIPAA HITECH really takes a leap forward. So who is a covered entity? A covered entity could be a doctor, a clinic, or a hospital, or any medical provider who's essentially using transaction codes to interact with HHS and Medicare, Mediclaim. So anybody who touches the end customer, patients, is in the provision of a healthcare provider. It could also be a health plan, like the health insurance companies, HMOs, health plans that are administered by the company or the government, or it could be a healthcare clearinghouse. Anybody who deals with multiple entities to process health information is in the purview of being a covered entity. Business associate is a fairly broad definition, and one of the key tenets of doing business in the healthcare community is that anybody who has access to PHI, protected health information, either in electronic form or in physical form, are now required and bound by the same regulations as the customers they serve. So who are business associates? It could be anybody starting from IT service providers. It could be accountants. It could be your IT service providers or MSPs, security service providers. It could be your garbage collectors and electronic medical record providers, or your legal attorneys. Anybody who has any visibility or ability to access or deal with patient health information, protected health information, is in scope of being a BA. And if you look at number of business associates that are out there, there are about 2 million, roughly about 2 million business associates that are out there, along with about 600,000 healthcare providers, starting from small doctors to large hospitals. So some of the key changes that HITECH Act in 2009 brought about that really made HIPAA enforcement to happen. And of course, there was a lot of federal money, EMR grant allocated to make sure that the electronic medical record adoption is accelerated. But let's talk about some of the changes in HITECH Act first, and there are about 7 absolute game changes. One of the key changes was to increase the fines from previously $100 to a larger amount of $50K up to $1.5 million per year, and there are new criminal liabilities for not following or not becoming HIPAA HITECH compliant. There are now, as part of the HITECH Act, business associates and their subcontractors are obligated by law to be compliant. And there are new data breach notification requirements on both business associates and covered entities to report to HHS if there is a data breach that happens. And non-compliance fines are returned to the enforcement agencies and also shared by whistleblowers who are able to point out any deficiencies or data breaches that are not previously reported. So there's a lot of incentive and penalties being put in place to ensure that HIPAA HITECH is being adopted and enforced. And then state auditor generals, besides the HHS, can also bring about civil actions for enforcing HIPAA HITECH on both covered entities and business associates. So what's really driving the market? It's really about HIPAA HITECH enforcement with the new guidelines that I talked about, new fines, new guidelines, but there's also a big carrot, as it were, put by the government. Government has set aside about $28 billion in stimulus money for EMR implementation. So any covered entity that wants to get the federal EMR grant, they can get a grant of up to $44,000 to $60,000 for small offices, all the way to about $2 million plus for large hospitals. But the catch is, in order to do that, they need to demonstrate meaningful use of the electronic medical records, which essentially comes down to providing some proof that the medical entities or the business associates are going to take steps to safeguard and protect electronic health information. So they need to do a security risk analysis to demonstrate meaningful use, among many other requirements. So why worry about all this? So one of the key things is that this is not an isolated incident, but there are breaches happening every day. And anybody who's not enforcing HIPAA HITECH runs the risk of getting breached, compromising patient information, and press and media is pretty much this on a weekly basis. There are some major breaches that are happening. Part of the reason is that cyber attackers are getting more and more sophisticated and organized. And they're no longer targeting just the large companies like Walmart and TJ Maxx that were making headlines a couple of years earlier, but they're also going after smaller businesses who are less prepared to deal with such security breaches. They don't, maybe some of them do not have any IT personnel, for example, or security officers, so they are reasonably easier to be breached. And this is borne out by market research that the number of security breaches pertaining to personal health information has been quite rampant. So this is happening today, and there is a huge need for businesses, for medical businesses, covered entities, and business associates to take preventive steps to remediate and deal with such issues. So this is talking about 6 million individual records were compromised. These were reported to HHS. Even smaller data breaches, which are less than 500 in number, they were reported, and in the first year there were 9,000 smaller data breaches reported. And OCR has clearly set aside a goal of starting the audit of businesses in 2012. They've given out the contract to KPMG, and this is a recent breach that happened with TRICARE, and Department of Defense is being hit with a $4.9 billion lawsuit following the breach. So HIPAA HITECH, because of the new practices, new regulations, and the new enforcement of the regulations, have really caused a lot of headlines and news, and breaches are really taking place. So as a medical provider, as a covered entity, as a business associate, it behooves us to deal with securing the patient information, securing the protected health information. So what is protected health information? What I want to do next is to describe protected health information, and then talk about what are the steps that a covered entity can do to prevent as they deal with subcontractors as business associates. What are the questions that a covered entity needs to ask its vendors and business associates to ensure that PHI is protected and safeguarded? So let's start off by talking about what is PHI, and then jump into some of those questions and processes. So PHI pertains to individually identifiable health information. It could include information about the person. It could include information about the healthcare of the individual, any payment information. It could include name, address, birth date, social security number. So it's fairly broad. And this could be in electronic form, or this could be in paper form, physical form. So the key requirements from the HIPAA HITECH privacy and security rule are essentially that there are 4 categories of procedures or safeguards that needs to be enforced. There are a number of administrative procedures, such as policies, procedures, training of employees that need to be put in place. There are physical safeguards, which is around electronic media, around physical media, fax machines, etc., that needs to be enforced. And then there are a number of technical services, security services or processes, exchange, how information, electronic information is exchanged, how information is accessed, who gets to access the electronic information. All those mechanisms are in the purview of HIPAA HITECH. So zooming in a little bit more on the security requirements. The bottom line requirement is that protected health information, wherever it resides, whether in the covered entity or in the business associate environment or in the vendor environment. Security law requires that PHI must be secured, whether in electronic form, whether in physical form, whether the data is sitting on servers, workstation, backup, and laptops, mobile media, doesn't matter. Or if you're accessing the data on the fly, in transit, over the web, through a mobile device or a laptop, every information communication involving PHI needs to be encrypted and secured while transmission or when it is rest. So going back to the primary question that we started out with is, how do we ensure and what can C's, covered entity and BAs do to build a relationship around PHI, and what can C's do to ensure that business associates and vendors are adhering to the HIPAA HITECH requirements? That's really the key question that we are after. So with respect to HIPAA HITECH, covered entity has shared responsibility along with business associates and vendors to ensure and implement HIPAA HITECH. So what does it mean? It means that the covered entity needs to have a very good solid BA agreement to ensure that business associates and vendors that they work with are going to be safeguarding PHI, protected health information, and are implementing the adequate privacy and security requirements to safeguard the information. And I'll talk about what goes into the contracts based on our experience a little bit more, or processes that are required to enforce what's in the contract. Further, business associates are required by law, and covered entities do. Covered entities are required to have a breach notification plan to report any disclosures that happen. And so if a breach happens in a business associate environment or a vendor environment, it's required by law that the business associate or the vendor report that breach to the covered entity, and the covered entity will report it to HHS along with BA, along with the business associate. So the reason why covered entities need to worry about this is because this is part of the law, and secondly, if there's a breach that goes unreported, then HHS and OCR and whistleblowers can potentially go after you, come after you, and that could be a big issue with respect to reputation and fines that might come about. This is also required. HIPAA HITECH enforcing HIPAA HITECH and adopting HIPAA HITECH is also required, as I said earlier, to get the federal EMR grants. Whatever be your size, if you're interested in getting the federal EMR grants, you have to do a risk analysis. You have to ensure that proper safeguards are in place to ensure that patient information is not compromised. So at the end of the day, these are best practices that protect and safeguard PHI information and makes you, the covered entity, secure and compliant. From the BA and the vendor perspective, they also share a responsibility with the covered entities to implement HIPAA HITECH, to implement the security rule, put safeguard measures in place, and put vendor agreements with their subcontractors. So if they're working with, business associates are working with their vendors who are going to be handling patient information, they also need to ensure that they're putting contracts and safeguards in place to ensure that patient information is not compromised. And of course, they need to report any notifications to covered entities, and these are part of best practices that business associates need to implement that will make them secure and compliant. So what are the key questions that covered entities need to ask business associates and external vendors to ensure that their business associates and vendors are indeed going to take adequate measures and steps to safeguard PHI? As I said earlier, the covered entities have a shared responsibility along with their vendors and BAs to ensure that they're protecting PHI. And they need to be proactive about ensuring that all the vendors, all the business associates that they work with are securing and taking adequate steps to ensure privacy and security of the data, PHI data. So the first step that we recommend that a covered entity ask is whether a BA or a vendor has performed a self-assessment. And a self-assessment is really the first step in understanding the level of compliance, the level of safeguards that exist today. And if they have gotten a third-party auditor to look into their assessment status, that's fine. They should be able to create, generate a report and show it to you as a covered entity. And what is the status of remediation? If they've gone through a self-assessment, have they taken care of the high priority areas, that gaps that the self-assessment may have found? So having a complete understanding, a clear understanding of the self-assessment status and the remediation status of a BA or an external vendor is an important step in the direction of making sure it's safeguarded. The second question is, have you, the BA or vendor, conducted a risk assessment? And can you provide a copy of the results? Now, these are, risk assessment is a very specific requirement to ensure that the information, PHI, as it is residing on different parts of the organization, devices, servers, laptops, is secure and handled correctly. And along with the risk assessment question, there needs to be specific questions around how is data being secured for mobile devices or laptops, cell phones, etc., if data is being accessed remotely. The third question is, what type of background check do you perform on your employees? And this is again a question that drives home the point that employees in the organizations that you work with, business associates and vendors that you work with, need to be educated and trained on the risks that is associated with handling patient data. And background screening is a move that essentially mitigates that risk so that they are trustworthy in the sense of being able to train these employees and demonstrate performance to adequate standards that that HIPAA HITECH training requires. The fourth question, very important question to be asked, is how is the PHI data going to be stored? Where is it going to be stored? Who is going to access it? How is it going to be shared with internally or externally with external vendors, and how is it going to be transmitted? So if you go back to the requirements of safeguarding PHI, what this question is essentially asking the external BAs and vendors is, are you going to be taking adequate steps to protect access and transmission of the PHI? And not only the covered entity needs to ensure that they are doing it internally, they also need to ask these questions to the BAs, external BAs and vendors that they work with to ensure that PHI data is secured end-to-end. This goes back to the employee training issue. The fifth question is, do you provide privacy and security awareness training program for employees? Again, the idea is that organization as such, not just processes, but employees, processes and tools in place are working in unison to ensure that PHI is secured. The way PHI is stored, the way PHI is handled, the way PHI is shared externally, which will be done by employees. Everybody who's involved in handling PHI data needs to be trained with respect to what are the do's and don'ts of handling PHI data. And finally, this is again, this question might be a little tougher, but sometimes a covered entity, depending on the leverage, they can also request that if they want to perform an on-site review or audit, and whether the business associate or vendor would like to do that. Again, this goes back to the joint shared responsibility from the covered entity point of view. So a first-hand on-site review would provide a first-hand glimpse of how privacy and security procedures are being handled. Are the employees really trained? So doing a first-hand audit or first-hand review would really give a glimpse on how ready, how trained the employees are, how are the security and privacy procedures being enforced in the BA environment, in the vendor environment. And then also asking the same question to the BAs about their subcontractors. Do the BAs have agreements in place with their subcontractors and vendors and people that they work with to ensure that if they are sending out PHI information physically or electronically, are they protected? Is it going to be protected? Are those vendors and employees in those companies trained? Are they trained? Do they have technical procedures or technical processes, encryption tools to ensure protection of PHI, security of PHI? And the business associate agreement that I alluded to earlier that the covered entity is going to be putting in place with their external vendors and BAs. Again, depending on the leverage that a covered entity has with the business associate, they can put some of the above requirements in a contract. The ability to train employees, the ability to handle PHI data, the ability to enforce and do a on-site review if necessary. All of this could be put in a contract. So this is fairly involved, and the question that we set out to answer is, given all these requirements, given all these HIPAA HITECH privacy and security requirements, and given the fact that covered entities they have a shared responsibility to ensure that the business associates and contractors that they work with vendors that they work with are enforcing HIPAA HITECH, this becomes a daunting challenge. And so next I'll talk about some automated tools that automates this whole process of assessing, managing the process. The tool that I'm going to talk about is SecureGRC, which manages and automates the whole process of managing business associates and vendors through an automated tool and an automated process. So eGestalt is the company that I come from. So we offer a cloud-based security and compliance management solution. We sell through the channel, and it's a completely multi-tenanted solution, which means that every partner and customer has a virtual instance in the cloud, which is completely secure and completely isolated. And in the tool, we have completely automated best practices and policy and procedure templates that are available in the tool that can be customized by the end customer, by the end user, and the channel partners to suit their organizational needs. There are multiple product versions that we have. We have the enterprise version, which is for medium to large businesses. There is the SMB versions, small medium business version of the tool, which is focused around small to medium businesses, as the name suggests. And then we have a version of the tool to do vendor and BA management, really focused on the problem of managing external vendors and business associates. That is the focus of the discussion today. And the solution scales up seamlessly from small practitioner offices, 1 or 2 doctor offices, all the way to large hospitals. It's the same platform, same GUI, but packaged in terms of different features. So the tool is a self-assessment, starts off with a self-assessment where the end user is asked a number of questions that translate to yes and no responses. So they get prompted depending on what kind of assessment they are undertaking. They get asked these questions, and along with the question, they can also attach evidence to respond to these questions. They have built into the tool, they have lots of information under the knowledge base section. They have access to policies and procedure documents, which they can download and customize to their needs. And our channel partners, who are trusted advisors that work with the end users to help them get that customized. There's also a lot of information about how to interpret the question, because a lot of these questions or the citation requirements are very, very terse. They're legalese, and it might be hard for somebody who's not living and breathing HIPAA HITECH to understand what are the implications of a particular question. So we provide detailed guidance on how to interpret the question, and also provide best practices that are typically followed by organizations to be able to answer yes for a particular question. So the tool has complete guidance with respect to how to interpret the question, how to answer yes, and how to deal with making a change so that the organization, the business, is able to become compliant by addressing the needs of the regulation. There's also a built-in risk model into the tool that is associated with every question, every citation, and then there is an overall risk rating that can be generated based on the organization's answers, based on the end user answers, and this basically gives the business a complete overview of their risk rating, where do they stand, and what's the risk level that the business is at any point in time. There's a real-time dashboard that gives, as I said earlier, the risk rating of the business, and as you answer questions, as you address the gaps, the arrows, the risk rating can go from right to left, and there's a detailed risk rating report that you can print out from the system that gives you exactly which questions are unanswered and which are the most risky ones that you need to deal with. So let's start off with the BA and vendor management process. How does a covered entity go about using the tool, and how does it go about automating the process of managing their external vendors and business associates? So the first step is to create a covered entity account in the tool, then add a list of business associates and external vendors that need to be managed. That essentially entails adding their addresses, email addresses, phone numbers into the tool, and I'll show you a little bit how that is done in the tool in the next few slides. The next thing after the BA list of business associates and external vendors have been added into the tool, then you can use the tool to send out what we call a high scan questionnaire, which is a short questionnaire with about 20 questions, which are the key questions that a covered entity needs to ask the business associate or the external vendor. That is sent through the email, through the tool via email to all the business associates and external vendors. External vendors and BAs get an email notification that the hospital or the doctor's office has sent them a little questionnaire. They log into the tool, answer the questions with all the help that I showed you earlier that's available in the tool. So they don't need to be an expert. They don't need to be a HIPAA HITECH expert. The tool will guide them through the questions, provide them copious help to answer the questions. Once all the BAs have responded to the questions, the covered entity through the email, through the tool, will get rolled up responses from all the business associates and vendors, and the covered entity at any time will have a snapshot of their progress. The covered entity will know exactly how many of them have responded to the questions, how many of them are in progress, and our channel partners will work with the covered entity to manage this process if need be. So once the responses from all the BAs are available, the covered entity report will have complete description of the responses from all the business associates, what the risk level that the different BAs have, and the covered entity can then focus on going after the high-risk business associates who are really very, very underprivileged and under-ready in terms of dealing with HIPAA HITECH issues. They are the most risky ones, and we have some of our customers, some of our hospitals who typically have 300 odd BAs, or if not more. So out of the 300 odd BAs, they might find that 100 of the BAs in the group of 300 are really very risky. They have high risk. So then the covered entity, the hospital in this case, would reach out to the 100 BAs, the high risk BAs, and work with them, work with the channel partners to implement HIPAA HITECH guidelines in those 100 BAs first, and then follow them up with the medium priority ones. Low priority ones can be left alone if the hospital so desires, or if the medical organization so desires. So the process is really very simple. Everything is automated through the tool, and you log into the web and manage the whole process. As I said earlier, we sell this solution only through the channel partners who would work with you, the end user, to make this happen. Now let me show the process that I described through the tool snapshots that I have in the next few slides, and then we'll open it up for questions. So this is what the tool login screen looks like. You log into the screen, add a list of business associates, which means that you add a number of email, first names, the name and email address of the business associates and the vendors that you want to send this out to. Then you select the vendors and the business associates that would that you would like to receive the assessment via email. Now, each vendor, each business associate gets a list of 20 questions that they need to ask, that they need to respond to. And these 20 questions are along the lines of the 7 questions that I asked earlier, that I described earlier. They're focused around security and privacy and training related issues. So they get to answer these 20 questions, and they have adequate help, as I said, in the tool to be able to answer yes or no for these questions. At any point in time, the covered entity or the channel partner, depending on who's managing the process, has a complete view of the business associates and the vendors. How many questions have been answered, how many of them have been returned with complete answers, etc. And the covered entity, the hospital or the doctor's office, at the end of the process will be able to generate a report on compliance, which is really a roll-up view of their internal compliance status and all the external vendors, BAs that they sent out the assessment to. They would have a snapshot view of how many external BAs or vendors are compliant. In this case, the survey was sent out to 8 people. 3 of the vendors, 3 of the BAs were found to be very high risk. 3 were high risk. 1 was compliant. They were probably keeping up with the HIPAA HITECH requirements, and another one was moderately compliant. So this gives them a complete view of the compliance status. Then you have the names of the people, usernames, email addresses of business associates and vendors that are compliant and what the status is. And then you can also get a complete view of how many controls were implemented by which vendor. So essentially you have a complete view of the status, the compliance status, through that 20-question survey that was done. So the 20-question survey essentially allows you to understand the compliance level of BAs and vendors, and that's like a starting point. And then once you know the high priority risk items, high priority risk vendors that you want to pursue, then typically our covered entities would send out a letter to the BA or call them up, follow it up with a call, telling them about the compliance status, that they need to be HIPAA HITECH compliant and enforce that. So this process and the enforcement would happen by getting the business associates and vendors to take a self-assessment which has not just 20 questions, but a complete list of questions from HIPAA HITECH to ensure that they are completely compliant with all the requirements of HIPAA HITECH. The first 20 questions that were asked earlier was like a high-level initial list of questions that were the most important questions that were asked. It gets them to understand the status, the assessment status and the risk status of the BAs, but in order to ensure complete safeguard and privacy of PHI, the covered entity needs to ensure that business associates and vendors are completely compliant with HIPAA HITECH. And once the initial survey is done, the covered entity would work with the business associates and our channel partners to first go after the high-risk BAs to get them to be compliant, followed by medium and low. So it allows them to divide and conquer and process the various business associates and to manage the process through the tool. All of it is done through the tool. So in summary, just want to reiterate that covered entities have a shared responsibility along with business associates to implement and enforce HIPAA HITECH. There are automated tools out there like SecureGRC being certainly the only one that I know at this point that allows you to completely manage the process. It allows you to also become more secure. It allows you to earn the EMR dollars and harden your security practices, of course, because if there's a data breach for whatever reason, that could be very costly. It could lead to fines and, of course, brand damage. So we recommend that every covered entity implement a formal vendor management program and have a BA agreement in place to safeguard PHI with a breach notification plan. And again, security and compliance is a journey. It's not a one-time event. I want to re-emphasize that. It's not a once a quarter or once a year event. It's a constant set of best practices and procedures that need to be followed. Whenever a new employee joins, wherever new IT infrastructure or an addition is made, compliance, self-assessment, risk assessment needs to be done to ensure that security and compliance is not being compromised. So with that, I have some references here, and by the way, the webinar will be available on the web if you want to view it. Feel free to reach out to me if you need more information. With that, I'll open it up for questions. Mike?
Great. Thank you, Anupam, for presenting. Here's our first question. You stated that eGestalt is 100% channel-driven. Is it through distribution or with direct partner agreements with system integrators, VARs?
We have a two-tier channel partner strategy. So we sell through distributors who have resellers. We also sell directly to resellers who can sell to end customers. So we have both the models supported today.
Okay, great. Is there specific sales and technical training available for these solutions?
Absolutely. We have a very sophisticated partner program which includes technical training, marketing training, sales training, which allows you, the channel partner, to package and resell this solution. So we have a complete partner portal and lots of training available. So if you want to get to know more about that, please feel free to reach out to me. I'll put you in touch with the right folks in my team.
What are the shared risks associated with vendor management, and what if they are not doing it?
Yeah, so that's what I was saying earlier. The shared responsibility is really around, from the covered entity perspective, is to ensure that any business associate or vendor that they work with are HIPAA HITECH compliant. Because at the end of the day, it's their patient information that the vendors are dealing with. And if they're not ensuring the privacy and security of the patient data, then they essentially will be held accountable in a way, because their patients might sue them, right? Or there might be you might get audited where both the covered entity and the business associates will be jointly responsible. So there is certainly a shared responsibility there.
Okay, thanks, Anupam. How does SecureGRC help alleviate the risks?
Yeah, so as I said earlier, the way SecureGRC alleviates the risk is that we have a comprehensive compliance management solution. So we have taken HIPAA HITECH requirements and built a questionnaire that's comprehensive and deals with all the requirements of HIPAA HITECH. Not only that, we have taken the HIPAA HITECH legalese, the requirements, and interpreted them and we made it accessible for anybody who's not a HIPAA HITECH expert to interpret it and enforce it. So our tool essentially provides a complete soup to nut solution to find the status through a self-assessment and then do remediation by working with our partners who will work with you to help with plugging the gaps.
Okay, great. Thank you, Anupam. We have no more questions. I'd like to thank you, Anupam, for presenting today. We're going to have the recording of the webinar up on eGestalt's website at www.egestalt.com. Thank you, Anupam, for presenting, and thank you to the attendees for coming to the webinar. Have a great day.
Thank you all.